to Body Talk Part 3 of a 3-part series. In Part 1, we talked about some basics about defining body image. In Part 2, we explored a little bit about self-assessment on our own body image. And today, we will discuss a path to body acceptance. Okay. So I'm Emily Kerr, a registered dietitian at the Student Health Center at LSU, and I'm going to let my colleague introduce herself.
Yes, thank you. I am Crystal Loop. I'm a wellness coordinator in the Office of Wellness and Health Promotion with Emily in the Student Health Center. And just to give you all a little bit of information about the Student Health Center, we are located on Infirmary Road past the School of Music on campus and near the Enchanted Forest. We have 3 service areas in the Student Health Center, including our medical clinic, our mental health service, and the Office of Wellness and Health Promotion, where Emily and I are housed. We're also currently offering both in-person and telehealth appointments. So check our website listed on this slide for the most up-to-date information about our services and how to access them. We also want to give a trigger warning before we get started today. So we are going to be talking about body image, which for many of us can be a distressing topic. We're going to be talking about weight, body shape, and size, as well as eating disorders. We'll also be using words like fat and thin potentially in this conversation, so we want to make you aware of that before we have this discussion today. And Emily and I want to bring to this discussion our own lived experiences in our bodies. We have our own unique experiences with our body image living in our respective bodies. So for myself, I am a cisgender female and I live in what I consider to be a larger body. And in my life, I've experienced times of discomfort with my body, as well as times of greater self-acceptance.
And I, Emily, am a white cisgender female. I live in what I consider a smaller body. I sometimes experience discomfort with my own body image and also times of increased acceptance. And I continue to work towards ongoing acceptance.
Thanks, Emily. So as we bring up our own personal lived experiences, we also want to note the privileges and biases that we may each have for different reasons. So while I live in what I consider to be a larger body, I still do experience privilege due to my size, my shape, and my mobility. While I also identify as a person of color too, I also experience light skin privilege, and I've had the experience of passing as white. And the reason why I bring up these privileges and potential biases at the beginning of this discussion is because if these are left unchecked and sort of untreated, they can contribute to some assumptions that are made amongst us or other clinicians in the helping field. So Emily and I are both aware that whether it's medical professionals, mental health professionals, nutrition professionals, or other healthcare clinicians, gender bias, racial bias, weight bias, and more can really get in the way of us providing accurate and supportive care to people. So it's our hope that as we bring up these barriers and biases that we can bring these to light and also ask you to consider what may be your own and contribute any thoughts you might have on this. So we will have our contact information at the end of this presentation. Feel free to send any feedback to us about that.
Okay, so just to give you guys a little information about what we're going to cover today, we're going to review the relevance of body image, some concepts to strengthen body image, identifying and embracing the stages of body image acceptance, exploring self-compassion as a tool for healthy body image, tips for practicing mindfulness, setting boundaries, and additional resources. So reviewed the relevance in each part of this series. So we're going to review it one more time. I really, really love the quote in the picture on this slide, and want to read it because I find it so important. Negative body image has nothing to do with how you look. And when I think about this, I know individuals with smaller bodies with very negative body image, and I know individuals with larger bodies with neutral or positive body image. So it truly is a mindset and mental challenge more than a physical one. So dealing with negative body image does not discriminate. It can affect individuals of all ages, races, genders, ethnicities, socioeconomic status, and there is research to support that unhealthy body image is relevant in the college age population, which for many can lead to significant distress in their daily lives. Disordered eating is one way some people cope with an unhealthy body image. An estimated 30 million people in the US struggle with an eating disorder at some point in their lives. And that being said, research shows improvement in how women and girls feel about their bodies when they talk about the pressure to conform to societal expectations. And so talking about our challenges with body image really can help improve body image.
That's great news, Emily, because that's what we're doing today. So we want to start by also defining what body image is. If you viewed parts 1 and 2, you should have a pretty good grasp on this, but for those of you that may only be viewing this or need a refresher, body image is defined as one's thoughts, perceptions, and attitudes about their physical appearance. Body image refers to how you personally experience living in your body. This is sometimes called embodiment, and I really like that word. I think it's really concise and helpful. So body image is subjective, meaning it is about your personal experience, and it may not necessarily match what others may think or feel about you. Because body image is all about your thoughts, feelings, and attitudes about yourself. So body image does not only involve these thoughts, feelings, and attitudes about your body, but it also includes that physical experience or sensations that you may experience while living and moving in your body. Body image is complex and multifaceted, and it's influenced by an infinite amount of factors over the course of your lifetime. It's also ever changing and can fluctuate. And again, our goal with this program is to help you determine what your body image is currently and help you stabilize or develop a more healthy body image if that's something that may be beneficial to you. So today, this discussion will be focused on really strengthening your body image. Part 2 really focused on some obstacles to body image and identifying those as well as beginning to overcome them. And now we'll talk about some skills to strengthen them. So first I want to read this quote from Marcy Evans, a dietitian who has an excellent social media account that we've really plugged throughout the series. She says, improving your body image is not about changing your body. It's about making what is less painful. And our goal, again, with this program is to reiterate that. We are not going to talk to you about how to change your body or your physical appearance, but we're going to give you strategies to reduce your pain and discomfort and improve that experience of living in your body. Body image work is dense, again. So while we cannot guarantee that we'll meet every need to total body image healing, this will be a great starting point for you. We also know that, again, body image affects all of us mentally, emotionally, and even physically. So when we're experiencing distressing emotions about living in our body, these emotions can trickle into and affect other aspects of our lives too. We know that body image and self-esteem directly influence each other. So typically, if a person has a negative or unhealthy body image, they will also have lower self-esteem. On the flip side, strengthening your body image or developing a healthier body image can improve your self-esteem. and also teach us to just be more attentive to ourselves, learning how to pay attention and listen to our bodies so that we can learn and thrive. Learning to listen to your body in this way, which we'll talk about more in this presentation, can prevent or interrupt harmful or self-destructive behaviors like disordered eating or exercising patterns, restriction, depression, anxiety, self-harm, or substance abuse. We're going to talk more about how to really pay attention and be attentive to yourself throughout this presentation. And lastly, strengthening your body image can help you develop a clearer, more accurate perception of yourself, one that is less distorted. And this can help you feel more comfortable and confident living in your body, which is ultimately what most of us want. So in part 2 of our series, we mentioned, we talked about body positivity and self-love as being something that might be challenging for some folks. It can be difficult to love our bodies when we don't even really tolerate or accept them. So imagine someone asking you to love a particular food that you strongly dislike or even hate, a food that might make you feel disgusted. This is an impossible ask, right? It's similar with our bodies. We have to move through gradual stages before we can embrace loving ourselves. And as we go through these stages, please note that it is okay to be in any stage that we talk about today. So the stages listed on this slide can be applied to many different life processes, but we're going to apply them to body image specifically today. The first stage is assessment. Figure out where you are in your body image work. What are some of your strengths? What are your complaints? And what causes you the most distress? If you need a little bit more information about that, part 1 of our Body Talk program really does address some of those questions. Also, figure out where you want to be in this stage. Would you like to develop more tolerance or love towards your body, acceptance or compassion? And after you assess yourself, the second stage is tolerance. So one definition of tolerance is the capacity to endure pain or hardship. Notice how this is not yet quite accepting your body, but it involves having the ability to endure the distress you may feel. After tolerance comes acceptance. Acceptance is the action or process of receiving something as adequate or suitable, like your body. So acceptance takes tolerance a step forward from enduring living in your body to accepting it as adequate and suitable. The fourth stage is compassion towards your body. Emily will talk more about self-compassion in a couple of slides, but compassion is defined as a feeling of deep sympathy accompanied by a strong desire to alleviate suffering or make things better. So when turned towards yourself, compassion entails being warm and understanding towards your suffering, failures, or inadequacies, rather than ignoring your pain or being self-critical or harsh towards yourself. The final stage is love. Loving yourself and your body means having a high regard for your own well-being and happiness. It means truly valuing your whole self, your body included, as someone who's worthy of respect and care. Again, it's important to know that no matter which stage or stages you might currently identify yourself as being in, you do not have to experience self-love to strengthen your body image right now. Set goals for yourself that are realistic and that reduce distress, maybe beginning with tolerance or acceptance so that you don't become easily discouraged. We use these stages as a guide for you to better understand where you are and where you would like to be.
So in thinking about the stages that Crystal just covered, starting with assessment, so that's a stage where we're reflecting and collecting data from ourselves about what we feel our relationship with our own body image might be. If we already recognize an unhealthy body image at this stage, we may want to ask ourselves this question: am I disgusted with my body image? And the reason this is relevant and an important question to ask is because negative body image can lead us to engage in behaviors such as potentially binging, purging, restriction, excessive exercise, or a host of other unhealthy behaviors in attempts to escape those feelings of disgust and as a way of trying to fix or control what we think is causing our unhealthy body image. While the feeling of disgust itself isn't necessarily harmful, the behaviors that we may engage in as a result of feeling disgusted could be unhealthy. The feeling of disgust could override our fear or consequences of engaging in unhealthy behaviors. So that might just sound like a lot of words at this point. So I want to give a specific example. Thinking about a person that might feel disgusted with their body weight specifically, an effort to escape that disgust they feel about their body weight, they may attempt to control their weight by restricting their food intake. It could be any behavior, but I'm just using this one. So restricting their food intake to the point of not meeting their energy or nutrient needs in hopes of losing weight, which they hope will alleviate that feeling of disgust they experience with their body image. Even if they recognize that there might be potential health risks of engaging in restrictive eating, their disgust might override the fear they have of any negative health consequences. So hopefully we want to identify some ways that we can shift from acting out of disgust and self-criticism. And practicing self-compassion can be a very helpful tool in doing so. And also help us move through those additional stages that Crystal covered, from tolerance to acceptance to compassion, and hopefully at some point self-love. And as she mentioned already, we will not move from disgust to self-love without working through some of those other stages.
That's a great point. I've worked with some clients in the past where asking them to love themselves really it seemed like an impossible ask again. And at that point, I didn't really understand why. And these stages really helped me also as a clinician understand that sometimes my goals for other people were not realistic. I really needed to think if someone's disgusted, maybe the first thing we can work on is just like becoming more tolerant. So
yeah. And one other thing I'll add here is something that I bring up in a lot of my sessions with clients when we're talking about realistic goals is I compare really any goals that I'm working on with clients to a staircase, with our long-term goal being at the top of the stairs and we might be at the bottom. We first have to have a good foundation and we have to take little steps to get to that long-term goal. We can't just leap to the top of the stairs, but it is helpful to have the vision of what's at the top of the stairs so we know what we're striving towards, but then we have to break it down into smaller, more digestible steps. So I really feel like the stages you covered helps us to understand that better, like you said.
Excellent.
All right, so if we're unsure if we're setting realistic expectations for ourselves or if we're being overly critical of ourselves, we can ask ourselves, how would I talk to a loved one? Would I expect this of another person? And we need to treat ourselves the way we would treat someone we truly care about. So in treating ourselves like a friend, remember to be kind to ourselves, remind ourselves we're not alone in our struggles, and give ourselves time to feel our feelings without clinging to negativity. There is also research to support a positive role between self-compassion and aspects of psychological well-being. Additional research supports a protective role between self-compassion and negative body image, and therefore leading to a reduced risk of disordered eating or other unhealthy behaviors. So we have a video we would like to share, and before we do, we're going to ask you to watch what happens when these two friends talk to each other the way we might negatively speak about ourselves. But buckle up because it is kind of harsh. It's actually way harsh.
Oh, okay. Girl, you can't be crying.
I know. All right. Okay.
Woo. Whew, that was a doozy. Just a reminder, I love you very much.
I love you too.
When you smile, your face looks like a fat middle schooler.
Shopping with your body type will never be easy.
Everyone is skinnier and prettier than you.
The people behind you are staring at the way your fat hangs over your bra.
You look so ugly in pictures that I can't even look at them anymore.
Face it, with that cellulite, you will never be able to wear white.
You won't be sexy unless you lose 10 more pounds.
You should never get pregnant because your nose is going to spread across your face. He would have never cheated if you were skinnier.
When your boyfriend says that you're hot, it's just him trying to make you feel better for gaining weight.
You will never be able to go sleeveless, not even on your wedding day.
You will be more successful if you lost 15 pounds.
He's going to leave you for someone skinnier.
You're not even worthy of him.
You should be disappointed in the way you look.
Why can't you look better?
Why don't you look like her? Okay. I'm sorry. I'm sorry you feel that way. Our friendship started out very vulnerable, which I think that's how we got so close so fast. I knew a lot of the things about you, but I didn't know you had vocalized them to yourself so many times and on such deep levels.
When I watched you crying and I watched you, the pain that the words were bringing you, it's like, that is constant. That's literally 24/7 in my mind. That's like a thing that even since we did the video.
How many times have you watched it?
I couldn't even watch it the first time.
Really?
I can't watch it.
Yeah.
I can't look at myself. I hate how I look. Wow, I am hurting myself so much all the time.
All the time.
But
you just have to now pretend like you're talking to me.
right.
Yeah. You always tell me my lipstick looks good.
Right.
And my butt looks good.
Yeah.
Even though I don't feel that way.
Yeah. I just have to try to pretend like I'm talking to you.
Yeah.
Get ready.
Oh.
Crystal and I both feel like that video is so powerful. It's such a great example of what we've kind of touched on about, the things that we might say in our head and having more self-compassion for ourselves, and the things that we say in our head that sometimes we don't even realize we're saying really have a bigger impact than we may realize, and which is why it's so important to be able to recognize them and build some skills for redirecting. So Crystal is going to share some tools to help with that.
Thank you, Emily. Yes, I love this video. Before I share the first tool, I want to just point out that, one of the individuals in the video said, I'm just going to have to pretend to. And, there is like that term, like fake it till you make it. And sometimes with self-compassion, we got to act a little bit, act as if we are our own.
Like it's a skill to practice. Right?
Yes.
Like just start with, even if you're not fully buying in, just practice the tool anyway, and eventually the believing of it will come along.
And that's typically how we make friends anyway, right? Like we don't actually know if we're going to like somebody when we're meeting them for the first time, but we treat them well. And then, eventually we may become their friends. And so it's very much the same with ourselves. We can kind of court ourselves, pretend like we're interested or act a little interested. And then we may actually want to be a little bit kinder to ourselves. So our first skill that we're going to talk about today in doing that is body gratitude. Gratitude is simply noticing what you're thankful for. And it's an excellent practice for improving your relationship with your body and improving your quality of life as a whole. Research shows that people who take the time to notice and reflect upon the things they're thankful for experience more positive emotions. They feel more alive, sleep better, express more compassion and kindness outwardly, and even have stronger immune systems. So when we direct this gratitude towards our bodies, that means that we're noticing and accepting our bodies exactly as they are. We can appreciate our bodies, for example, for what they do for us each day, our strength, our mobility, our organ function, and the ability to rest. So some of these functions are unseen. We can also appreciate our bodies for housing our souls, for housing our personalities, our character traits. Think about what you do like about yourself as a person. And remember that these parts of you cannot exist without your body being their home. Focusing on non-appearance related qualities of our bodies and our personhood is so important. And this can help us appreciate ourselves much more in general. To take body gratitude a step further from noticing and appreciating it in your own mind, try journaling or listing your gratitudes each day. You can make a list of 5 to 10 things about your body or yourself that you appreciate. Another great strategy for strengthening your body image involves practicing mindfulness. Mindfulness is typically known as a specific type of meditation practice that involves being present in the moment and refraining from judgment of any kind. Being mindful in your day-to-day life can help you notice what's happening in and around you. This makes you more aware of your own thoughts and feelings as well as your surroundings. And being mindful can help you practice letting go of judgments, criticism, and expectations, which usually negatively impact our body image and experiences. As you practice being more mindful, we suggest that you start by paying attention to your thoughts, rituals, and language towards yourself. Are your thoughts about yourself negative or harmful? And what are they? Are they critical? Are you typically comparing yourself to others? Do your thoughts about yourself contribute to having painful feelings about your physical appearance? If so, simply take note of those thoughts and feelings and remember that you do have the power to change them, seeking additional support if needed. Pay attention also to some of your rituals around your body and body image. Do you have rituals around eating or exercise practices that might also coincide with negative feelings about your body? What about rituals regarding looking or not looking in a mirror? Do you avoid mirrors? Do you check a lot? Again, simply notice these things. Lastly, pay attention to your language when referring to yourself and others. How do you speak to yourself, even privately? How do you talk about your body and your physical appearance to others? How do you talk about other people's bodies? Notice the words that you choose. Are they kind or critical? Do you use derogatory words or polarizing words like fat or thin, good or bad to describe bodies? Though the foundation of mindfulness does involve refraining from judgment, sometimes just becoming aware of these things can give us the motivation that we need to make some changes.
So mindless eating happens to the best of us. So I wanted to review a great acronym to help us focus on mindful eating. So I'm going to start with the F for feel. Sometimes our emotions like boredom or stress or loneliness can trigger us to eat even while we're not physically hungry. So prior to eating, ideally, we would be able to check in with ourselves and distinguish between whether or not we're experiencing emotional or physical hunger. So the O is for observe, to observe how we are feeling physically before, during, and after eating. Do we notice stomach grumbling or feeling uncomfortably full? Often we think we're hungry sometimes when we're simply thirsty, or both hungry and thirsty. And something that really helps me to check in with myself about hunger is I actually sometimes have to stop and close my eyes and put my hand over my stomach and say, am I hungry here? Is it like grumbling, or is it here in my head? And that can help me just pause to take a moment to reflect on that. The C is for connecting with our senses when we're eating. A lot of times we have a lot of distractions around us, like a TV, or maybe scrolling through social media, or doing homework, or working. And also, in effort to connect, trying to be aware of any judgments we might be having towards our food, such as feeling guilt or shame or rigid thoughts and rules around food. The U here is for understand, and understanding the basics of balanced nutrition can really impact how we feel physically, and understanding and applying concepts of balanced eating can help us feel full, satisfied, and energized. The S here is for savor. So savor the flavor, take notice of aromas and flavors and textures, like when we're eating something, is it crunchy or is it smooth? Is it sweet or salty? Is it spicy or mild? Just really appreciating all the experiences of the foods we're eating. And noticing these details can really add enjoyment to our meals and our eating experience, and sometimes help us identify if we even really like something. I know for myself, utilizing some of these strategies helped me to identify that I don't actually like some of the things that I thought or don't like them as much as I thought I did, which actually helped me to make different choices so that I am enjoying things more fully. So that is just a really nice, concise acronym for helping us be more mindful with eating.
I love this focus card. I think it's very helpful. And I wanted to go back to connect, because when you talked about, connecting with your senses and being aware of any judgments that you might have, I cannot even count the amount of times that guilt or rules really got in the way of me enjoying my food. And when I think about it, like, those feelings really ruin some great desserts specifically.
Right.
And so, yeah. And desserts, they're meant to be enjoyed. They're a treat. And I really love my desserts, but I've certainly placed a lot of rules on myself in my life, and feeling guilty about eating something that really affects the taste.
Yeah, it takes away from the experience of being able to enjoy it. It's a distraction.
Yeah. So thank you for talking about that, Emily.
Thank you for sharing your own personal example. Okay, so we're going to talk about some mindfulness with exercise. Research suggests that people enjoy exercise more when they intentionally focus on surroundings and the feeling of moving. And I have to tell you, before I go through these things, that I do enjoy exercise personally, but I do have some challenges with being more mindful in the exercise experience. So really, to pause and consider our purpose is a helpful way to bring some mindfulness to exercise. Considering the intention that we have for exercise. We often focus on exercise as a means of managing weight, but exercise is beneficial for our heart health, our bone density, our mental health, and that's just to name a few. Considering additional motivations for exercise outside of weight management can help minimize some of the negative feelings we might be having about it. Unplug. So to bring more mindfulness to exercise, consider not listening to music. This is like really hard for me. I fill the exercise with noise. But consider not listening to music or podcasts or whatever you might listen to. Consider not talking on the phone or reading a magazine or watching TV. Try being fully present in the moment of exercise, whether you're in nature or you're on a sidewalk or you're on a treadmill. Tap into body sensations. Try to bring your attention to your physical experience. And one way I find this important too, is to help us identify if we're having some injuries or form issues. So if we're noticing some discomfort, maybe it's calling our attention to something that we shouldn't be ignoring. Are there parts of our body that are working extra hard? Does your body feel different today than it did another time you were exercising? For example, if you're swimming, you can focus on the water gliding over your body, the muscles flexing or releasing, and the sensation of your torso rotating with each breath. You can also use your breath as a cue to challenge yourself more or to ease up if necessary. Your inhale and exhale can be an anchor of attention while exercising. So like I was saying, super hard for me to not have some other noise. So focusing on the breath can give you something to have an anchor. If your mind wanders, that's okay. Just notice the thought and reconnect with your breath. Observe the tempo of your breath as you work harder and as you cool down. You can also play with different anchors of attention. So experiment with attentional focus points other than your breath. Maybe each rotation of bike pedals or the ups and downs of a lunge. You can switch anchors as you vary your exercise, but stay focused on the rhythm of your anchor, returning to it when your mind wanders. Also note your surroundings. There are two aspects of directing attention: focused attention and open awareness. You can practice both while exercising. You can tap into the latter by checking out what's around you, how the air feels, what's the temperature, what are the noises that you're hearing, and then commit to your workout. One of the attitudes of mindfulness is acceptance, not wishing the present moment to be different than it is. Exercise is a brilliant time to practice this. Do you notice resistance to the workout experience? Perhaps you're wishing it's almost done, or that pain in your foot would go away. But commit to your workout time, remember your reasons for being there, and try to stay present from start to finish. I know for myself, sometimes in exercise, when I start exercising, I think about being grateful for my body and my ability to move all of my limbs and have all of my limbs and have good enough physical health to be able to exercise. And then something else that I try to focus on, particularly if I'm outside, I love a beautiful sky. So if it's sunrise or sunset, especially, I tried to really take that moment in and have appreciation for the just simple beauty of the environment around me. Also, practicing self-compassion. Notice the quality of your thinking during workouts. Can you appreciate your current ability, speed, and endurance just as they are? If you work out in a group, can you let go of a comparing mindset? And instead of thinking of yourself, instead of comparing, thank yourself for showing up for this healthy activity, and then go at a pace that's just right for you. I definitely have heard from clients and have experienced that myself, having a competitive nature to feel like you want to be faster or stronger than some of the individuals in the group. Or sometimes I am competitive with myself where I want to go faster than the time I did before. And being able to practice more self-compassion and let go of some of that competitiveness with myself and just go at what my body is telling me is my comfortable pace has brought so much more enjoyment to exercise for me. It's not an intuitive mindset for me, so I have to be very intentional about that that self-compassion to just go at a pace that feels comfortable. And it really, really changes the exercise experience for me personally.
That is so true. And all of this information about mindful exercise was so helpful. We selected this graphic on the screen of an individual practicing yoga for a reason. So as you're reading through this, this is sort of a natural plug for yoga practice as well. So if you are struggling with incorporating some of these behaviors into your typical exercise routines, I encourage you to also consider practicing yoga, because these components are really woven into the foundation of a yoga practice and will help you potentially learn the skills that then you can apply to other fitness routines. So that's, there's my plug there. Yoga is a great physical, mental health, and spiritual practice that, can be really, really beneficial. And part of it is really focusing on yourself on your mat. So, just like you were saying, trying to teach you to stop comparing to others and really just tuning into your experience as a whole. I love that. So another strategy to strengthen your body image involves developing some communication skills. We're talking about setting and maintaining boundaries. So a boundary is an imaginary line that separates you from another person. Boundaries communicate how you allow people to treat you and what is acceptable in your personal space. Boundaries keep us safe, and they help us to feel stable in life. Everyone deserves to have boundaries and is worthy of boundaries being respected by others. Boundaries can be physical, mental, emotional, and spiritual. Physical boundaries could include how close you allow people to get to you physically, what types of touch you accept, and what you're willing to do with your body. Mental and emotional boundaries can include things like how you share your thoughts and feelings, how you accept or receive feedback from other people, and how you allow other people to treat you. Setting a boundary can be as simple as a single sentence. So if you're stuck in a conversation that you'd like to change, we have some examples of single sentences that might work in a variety of situations to set a boundary. 1, I don't want to talk about this anymore. 2, I'm not comfortable talking about this. 3, I'd like to change the subject. I like that one because that can be a really indirect way of setting a boundary that you don't want to talk about it, but it is less direct than saying explicitly that you don't want to talk about it. Or you can simply try to change the subject by just bringing something else up. Again, this is a really indirect way of setting a boundary, and you may have to say something more direct later if you choose that option. Boundaries can be used to keep your body image safe and stable too, and that's why we're bringing it up today. So here are some examples of boundaries that would pertain to negative body talk or body policing that you might experience from others, or if it's about you or someone else. So 1, I'm not okay with negative body talk or body policing. 2, my body, insert here, my eating habits, my fashion choices, my shape, my size, my fat is not up for discussion.
I love that one. I've used it before.
That's excellent. 3, I won't listen to or participate in body bashing. So if you find yourself surrounded by people that are talking negatively about themselves or others, and 1, that may be triggering for you, or 2, that really doesn't help you develop that tolerance, acceptance, compassion, or love that we talked about earlier, then setting that boundary may be really important for you. And 4, it's important to me that we talk neutrally, positively, kindly about bodies, our bodies or other bodies. If you really struggle with people talking about dieting in your presence, I know that for me, that's a real struggle. We talk about diet culture in part 2 of these presentations, so please visit that if you haven't and you'd like to hear more about it or contribute to that discussion. There are a lot of people who are dieting. It's a very common experience, and it's normal to hear about it often. For me in particular, talking about that or listening to someone talk about their diet can really impact my own judgments of self, my own judgments of what I'm eating, my exercise practices, and so on. So this is a really important one if you also struggle with hearing about other people's diet practices. 1, I'm not up for any kind of diet talk. 2, dieting isn't something I want to discuss. 3, I don't really condone diets or talk about weight loss anymore. You can add that one too. If it's something maybe you did talk about with the person and you need to say that you've made a change, you can always say like, I don't really want to talk about this anymore, or I've decided that this isn't really the best for me.
I love that you added that in because, you know, maybe we didn't identify some of our previous language as something that was harmful or not beneficial to us. So the fact that we can acknowledge like, yeah, I talked about this in the past, but I don't want to continue with that moving forward. I think that's such a helpful thing to point out. Thank you.
Yes. And you can always follow up with something like, oh, there's so many more interesting things that we can talk about, or I've got something really interesting that we can talk about. That can really help keep a conversation going and preserve a relationship that you may be really invested in, while also communicating that the content of diet, of weight, of body size and shape is really not appropriate for you to be discussing. And perhaps the other people in your life don't respect you stating a boundary, especially that first time. It's actually very common for people to continue to bring up topics that you may set a first boundary about. So be ready to set the boundary multiple times, and it's up to you whether you decide to enforce that boundary by either restating it, escalating the boundary, or just ending the conversation, or even taking a pause on relationships that may be unhealthy for you. You're the boss of your body here. So as we wrap up the discussion today, we want to remind you that all of this work, body image work, is not a one and done. It is a journey. And as long as we have our bodies, we're going to be on the journey. So changing our thoughts about our bodies and appearances can take a long time, even years for some. So give yourself some grace and be patient. It's also important to remind ourselves that we will not love our bodies 100% of the time, and that is normal and it's okay. Some days will be better than others, so continue exercising self-compassion, being patient, kind, and reminding yourself of your own humanity through the process.
So we have some resources here to review. Of course, Body Talks Part 1 and 2 would be a good resource to revisit. We did mention the body image workbook in Part 1 and I think Part 2 as well, but just another reminder that that's a great resource. There is a podcast by a dietitian named Christy Harrison called Food Psych, that there are tons and tons and tons of episodes. Really great resource to listen to if you're into podcasts and want to, explore more about body image. Health at Every Size, the website listed here. There is a book as well that really explores this concept, which is amazing. The Student Health Center also has an eating disorder treatment team. You can learn more about that on our Student Health Center website. Mental Health Service is another resource within the Student Health Center. And then, of course, LSU's UREC as well. We have some specific Instagram accounts listed here that you could consider following. We definitely feel like it's important to curate your social media following to help support a healthy body image. And so some of these accounts are still focused on some individuals or bodies or figure images, but we also wanted to point out that you could also consider following accounts that are not related to the human figure at all, something like landscape photography, so that you can still take in and consume beautiful images without it being focused on the human body at all.
I love that idea. That's a great idea, Emily.
So our contact info here, the Student Health Center phone number and website is pretty simple. Crystal and I's email addresses are listed here if you want to send any questions, feedback, or comments to us. Anything else to add, Crystal?
I think that's it. Thank you for listening today and joining us for this discussion.